Hey everybody! Thank you for coming. We're super excited to share our experience and our testimonies with peptides and just give you a little bit of education. I'm here tonight with my beautiful friend Missy. So we're both going to kind of share. Missy is a registered nurse. Her and I used to actually work together in labor and delivery. Then she went to the dark side and went to employee
The
health,
easy side.
the boring side.
Give me all the boredom.
Gosh. And then she's stealing all the other good nurses, just left and
Yeah.
right. She's just snatching them over to employee health.
Yep.
So, so just kind of if you don't know who I am, my name's Christine Jennings. I'm a nurse midwife. I've been a nurse midwife for 21 years, was a labor and delivery nurse for 3 years prior to that. And I jumped into the world of peptides in July because I was 47, doing all the things. I was working out, I was tracking my macros, I was eating the protein, I was doing all the things, I was strength training. And the weight was just continuing to go up. Like I had lost some weight a couple years before that, and then I had gained like 18 pounds over like a year or so, despite taking all the supplements and all the natural things and the things that's supposed to naturally increase your GLP-1, which FYI, they don't. Um, they just don't. And I can say that because I've used both now. I've used the injections and I've used the natural, and the natural doesn't do it. And so I reached out to my friend Kelly and said, okay, because I bought into a lot of the fear mongering, which many of you probably have. I had somebody message me today. She's like, what is this all that I'm seeing? I'm like, let me tell you, the media turned this into something crazy. Like GLP-1s have been around for 25 years. Like they were treating diabetes. And because they were treating diabetes so well, and then they were like, oh my gosh, like these people are losing weight. Then it went into like the weight loss stuff. So these aren't new. They've been around for a long, long time. And because they've been around for so long, they've been studied and we're finding decreased risk of Alzheimer's, dementia, decreased risk of cardiovascular disease, cancer, like so many things. So there's so many longevity benefits besides just the weight loss. So I reached out to Kelly and I was like, I've had it. I've done my research. I've decided these are not the devil. Like, I think I need to do this. And my first month, I lost like 8 or 9 pounds. And within 6 months, I lost 28 pounds. So now I'm down 28 pounds. I'm down to, as of this morning, 17.6% body fat, which is like,
Oh,
I've never seen those numbers on the scale. And I feel good. I have energy, like the inflammation's gone. Like it's not just the weight, but like the inflammation's gone. I feel better. Like I've never been at this weight like my entire life. And then since adding on the GLP-1, I added, well, actually I do tirzepatide. So many people ask like, what's the difference between semaglutide and Ozempic and Mounjaro and GLP-1? So semaglutide is the same. Ozempic is the brand name of semaglutide, which is GLP-1. Tirzepatide, the brand names are Mounjaro and Zepbound. So they're just the brand names. They come in a pen. You can only give yourself the dose that's prescribed, whereas what we have and have been using is tirzepatide, which is compounded, meaning it comes in a vial, you draw it up, you give yourself the injection. So you can give yourself a little bit less or a little bit more. You have more control over your dosage, so that's a huge part. And as I was telling one of my friends today, the biggest reason people have side effects is because they're often on too high of a dose or they go up on their dose too fast. So with the compounding medicine, I've never gone past 5 milligrams, you know? So even though my vial was 7.5 on month 3, I was giving myself only 35 units because 7.5 was too much for me. So since then, I've added on testosterone, ipamorelin, which helps with muscle growth, helps burn visceral fat. I've added on glutathione, which is your master detox peptide, helps detox your liver. If you've had a few too many drinks, it's great to take the next day. Helps with your skin, helps with immune support. I've also done BPC 157, TB 500. So that is, it's called body protective compound. So it comes from the gastric juices. So it's really great for gut health. So I take that because I have Crohn's. What else? Oh, GHKCU. So that's our copper peptide. So great for hair, skin, nails. It's going to increase collagen and elastin production. I haven't taken collagen in months, and I was like a diehard collagen girl. I haven't needed the collagen because the GHKCU has like done the trick. So also helps decrease inflammation. So I think those are all the ones I've done. I'm getting ready to try MOTS-C. I had just ordered 2 peptides this month, so I think next month I'm going to order MOTS-C. So I've never felt better. I have more energy, like I sleep well, and that's why we're here tonight, is just to share how much these peptides have really like changed our lives. So, Missy, why don't you tell them your story?
So mine's just a little bit different. I back in 2023, that perimenopause, menopause weight got the best of me. I gained about 25 pounds. I was working out 3 to 5 times a week, doing low carb, low fat, all the things, everything, and nothing was working. My weight was not budging. And back in 2023, it was very taboo. Like, we
Yeah.
did not talk about,
No.
injections. And I
No.
actually went on a brand name of a semaglutide, and it worked so good. I dropped 30 pounds, and since then I've been been able to maintain it within about 5 to 8 pounds, more like the 5 pounds. And I guess it was last year I started doing a deep dive in peptides, because I was like, okay, semaglutide, that's a peptide and that works so well. So what else can I incorporate to help with the other perimenopause stuff? The brain fog, the inflammation that I, still had, the loss of energy was terrible. And I have been an insomniac since I did work night shift for over 17 years. I just didn't sleep. And what was working to give me a few hours of sleep just stopped working. So I was like, okay, I need to do some research. And I did. And Miss Christine actually reached out to me about something about a summer vacation, I think. I think that may have been it. And then we got into the conversation about this company and the peptides. And so I started with NAD, which absolutely was amazing for me for my energy. I also am doing the GHKCU. I did a round of Sarah Morellin, and my sleep had never been better. I wasn't taking any sleep aids at all. And then I've switched over to testimonies, still have phenomenal sleep.
Do you feel
Um,
like that worked for you just as well as the Summerlin did?
I do.
Yeah.
I absolutely do. I've thought about taking it in the morning. I'm like, no, I better not do that because I'm sleeping so good after I take it.
Yeah.
But yeah, I'm absolutely loving the fact that, I haven't had to do hormone replacement therapy yet. Not against it, but I am finding that these are working so well. So I'm super excited about it. Still, weary about the hormone thing. So really, really loving everything that I have tried. And I'm loving that, I'm there's so many people out there in this age range that are, go struggling and going through it, and they don't have to. And that's, you know, part of the reason why I want to do this. I want to inform everybody that it isn't as scary as the media is making it out to be.
Yeah.
And
I
there
mean, and
are other solutions.
I think that's the biggest part is, yeah, because back then, I mean, because Kelly had reached out to me a year, well, so in 2024, she had reached out to me because she was looking at this company and she's like, I want to get your thoughts because you're a midwife. And I was like, it's an interesting concept. And I was at the time, I was like so anti-injection. I was like,
Mhm.
no, they are horrible because we just didn't know because the only people who knew about them were like the endocrinologists because they were using them for diabetics. And that's what Kelly had said. So Kelly used to be a pharmaceutical rep. So Kelly is one of our partners. She's been with the company since the beginning, so for a year and a half. But when she was a pharmaceutical rep, she sold a medication for diabetes, and the GLP-1 was like the direct competitor. And she said it was hard to compete with them because they were working so well. And
Right.
so that's what she said, these are not new medications. But everybody thinks they are because now they have that weight loss indication. But they found because, they've been using them for so long that they've found, other uses for them. So
Right. Right. So, there's a question. Can you explain the difference between microdosing and the weight loss dosages? Like,
yeah.
why should one person should pick one or the other?
So that's a great question. So for microdosing is really if you have like less than 20 pounds to lose. So less than 20 pounds to lose, you can do microdosing, which is 2.5 milligrams of the tirzepatide. For the semaglutide, I forget what the starting dose is for that because I'm just
0.25.
0.25. Okay, that's what I thought. I personally recommend tirzepatide because I mean I know you did the semaglutide, but tirzepatide and head-to-head studies have better weight loss, like 26% versus 21%, less side effects. Now I haven't had any side effects because we start at such a low dose. So with the microdosing, it's 2.5 milligrams once a week, every week. Your dose never changes. And some people even do less than that. Some people do like half of that because with the compounding, you can say like, okay, well, I'm not going to do 50 units. I'll just do 25. But that's the microdosing. The weight loss dosing really is better for people who have more than 20 pounds to lose. And that was me is, I wanted to lose, close to 30 pounds. And I did. I hit my goal weight. So I did the weight loss dosing, but I never had to go up. So with the weight loss dosing, it starts at 2.5 once a week for your first month, 5 milligrams once a week for your second month, and then 7.5 milligrams once a week for your third month. So every time, so when I started, I did like half the dose my first week, and then I did like three-quarters of the dose my second week. And then on my third week, that's when I was at the full dose. So I kind of eased myself into it because I really didn't want to have side effects, and I didn't. And then I did the same thing with month two when it went to the higher dose. I started on a little bit less. And then on like the second week, I did like a little bit more. And then like the third week, I was on the full dose. And then when I got to the 7.5, I didn't even do a full dose. I did like three-quarters of a dose, and that was too much. And
Yeah.
so somebody had asked me, they're like, how did you know it was too much? I could hardly eat. Like, I didn't want to eat at all. Like, I remember like every morning I have like yogurt and berries and granola. I would get halfway through my yogurt and would feel like so full and just like, oh, I don't want to eat. And I was like, okay, that was too much. That was too high of a dose. So next week I'm gonna do less because you need to be able to eat. And that's what people think that they just, and I had somebody the other day, she was like, I'm still hungry. I'm doing 1,300 to 1,500 calories a day. I'm like, you need to eat more. Like that's not enough calories. So the way they work is they help to slow your digestion down so you stay fuller longer. Um, Also decrease your appetite. It gets rid of that food noise, so you're not thinking about food all the time. You're not like, what am I gonna have for a snack? What am I gonna have for dinner? What am I gonna have for lunch? What am I gonna like? I'm bored, so let me just go look and see what's in the pantry. It takes
Yeah.
all that away.
Yeah.
Um, and so then when you do your 3 months, so everything comes, not everything, the GLP-1s come in a 3 month subscription. Most of our other peptides are all 2 months. So when you get towards the end of that third month, you'll get an email saying that it's time for your reassessment. And then you're determining with the doctor on whether you want to stay at the same dose, whether you want to increase your dose, and they'll kind of help you decide on that. Most people don't have to increase, they kind of maintain. And then when they get to their weight loss goal, they start to kind of taper down and then just go to a microdose. And some people go off of it. I personally will not. I will always stay at a microdose
Me too.
just because of the longevity benefits.
Yes.
So,
Yes.
yeah.
Me too. Okay. Another question. Everybody's talking about like cost and they can get this online. And what do you what do you have to say to that?
There's a reason that the research grade peptides on the bottle says not for human consumption.
Right.
And it's crazy to me that people are so crazy about like don't don't reading all the labels and I can't have red dye and I can't have this and I can't have that, but yet you're gonna get some research grade peptide that you have no idea what the testing is. So with the research grade, all these like peptide labs, and a lot of them are like the big one, Peptide Science, is shut down because the FDA is coming after them because they're just they don't have the proper testing. So they're not now some of them have some testing, but you just don't know what you're getting. They don't, a lot of them don't have third-party testing, so you don't know if there's metals, if there's pesticides, if they're like you don't even know if it's the correct dosage. You don't know if there's cross contamination. Like you just don't know anything. So with ours, everything is medical grade peptides prescribed by a physician and that's shipped from a 503A FDA regulated pharmacy, meaning there's FDA regulations. It's NABP certified, so that's a certification pharmacies have to have for compounding. So everything is triple filtered, third party tested to ensure the highest purity, the highest potency, so that you know what you're getting. There's no cross contamination. Everything's personalized. They're not like mass producing peptides and letting them sit on the shelf. Like it's not done until your prescription goes there. We have our own dedicated personalized pharmacy, which allows us to do a lot of personalization. So when you order your tirzepatide or semaglutide, you can choose to have B12, which is going to help with energy, L-carnitine, which is going to help with fat metabolism, and energy, and then glycine, which is going to help with muscle preservation and sleep. So you can choose which one of those additives you want to do with the semaglutide or tirzepatide for both the weight loss and the microdosing. So it makes a huge difference. It's just not worth spending, the cheap stuff to put in your body. I mean, it's not
Right.
like, you know, it's a cheap Walmart shirt that, it's going to wear out in a couple months and you don't care. Like you're putting this stuff in your body.
Right.
Like you want to make sure
That's
that you're getting the right stuff.
Yeah, I love too that you can talk back and forth with the doctor. If you've got questions, you just log
Yep.
in and you have that personalization part of it too. And a lot of these places do not.
Right. So everything is guided by the physician. So the way it works is, if you're interested in ordering something, whoever you've talked to invited you, Missy or I, we, give you our link. You choose the peptide, and then it takes you to a medical intake form. So just like when you go to the doctor, and it's going to ask you your medical history, medications that you're taking, and then it takes you to the purchase page. You can do HSA, FSA. We have payment plans. And then once it's submitted, it goes to one of the physicians in our doctor network. So we have all licensed MDs and DOs. They'll review your intake form, and then as long as it's approved, and most of the time it is, unless you have some contraindication. But once it's approved, you'll get a text message, usually within a few hours. Now, depending on what time
Mhm.
of the day you order it, I mean, if it's like 10 p.m., it'll be the next day. But a lot of times, I mean, if it's 9 a.m., you may get a text by noon saying it's been approved with a
Yeah.
link to your patient portal. And for the GLP-1s, you get so much information. They send you like these are the benefits, this is how you take it, these are potential side effects. All the weight loss dosing comes with a prescription for Zofran. It's I don't know, I don't know how many come in it, maybe 15. But so in case you have nausea, those like first couple weeks that you're using it. But like I said, I mean, I didn't ever use my Zofran. Actually, I gave Zofran to my dog when he was going through his stuff. I was like, well, I got some Zofran here, so we gave it to Brady. But I never needed it. So all of it comes with that, and then you'll get an email when it's shipped. Everything. Oh, I happen to have this on my desk. All of our peptides come in this cute bottle. I don't know if you can see it. There you go. This cute little reusable bottle. It's insulated, so you can use it as a water bottle. You can use it. I mean, I'm gonna have all kinds of these after few months. But they really, the company cares about environmental impact, and they got rid of the big styrofoam containers and all that. So your peptides will come in this with two ice packs. So you can use this to travel with your peptides. They ship like within a couple days via FedEx Express. You'll get your alcohol swabs, your syringes, like everything that you need. And like Missy said, you will have unlimited access in your patient portal to ask your doctor questions at any time. So if you're having side effects, if you're wondering, should I go up on my dose? Should I go down on my dose? You can log in and there's no extra charge for that. So the price you pay includes prescription, shipping, supplies, doctor, everything. There's no membership fee. So some of these other places you pay $100 a month just to be a customer on
Yeah.
top of all the other stuff. I was talking to somebody the other day who they get theirs from a different company and they said often they didn't get a shipment or then in 6 weeks later goes by and they get two shipments right away. It's just we never have to worry about that. Like everything comes, like Ellie has been so like they're so on top of it with all the things and we have new stuff coming out all the time. Like we've been releasing a peptide like every week for the past like 2 or 3 weeks. And we've got we're gonna have diagnostic testing coming soon. I don't know when. So where you'll be able to just like stick a thing on your arm and get the blood drawn and like send it off. We're gonna have hormones coming soon. It's just a process to get all this stuff. So we're always like, honey, when is it coming? She's like,
Yeah.
it's coming, it's coming. It takes time to go through all the checks and balances and do all the things. So
And
um,
when she says honey, she's not talking to me. She's talking about our CEO.
the CEO's name is Honey Sagari. I know the first time Kelly was like, honey, honey, I was like, honey? But it's spelled Hanieh.
Yeah.
She's from, oh gosh, where is she from? I forget where she's from, but she's gorgeous and amazing and has like the biggest heart and the biggest vision. Like
Yes.
Ellie also does, they sponsor several orphanages in the Philippines. I think
Yep.
there's like 7 or 8 that we sponsored last year. So she's really into giving back to the community and just moving to moving away from the sick care model and into the longevity space. So like it's not just about weight loss. It's like I said,
Right.
we've got the GHKCU, which is great for besides the hair, skin, and nails, also really great for inflammation.
Yes.
Um, and then the MOTS-C helps. So many of them help for with inflammation. NAD, I did that. I forgot I did that one in August. That really helped with energy. So I kind of cycled through, and with most of these peptides, except for the GLPs, you can stay on those forever. The other ones, a lot of them, you'll stay on for 2 months and then you'll go off for like 2 to 4 weeks. Or like glutathione, I do that like a couple times a year. Like I did it in the fall and then I did it again just this spring because it was like cold and flu season and I was gonna be traveling. Um, and like the GHKCU, you'll do it for 2 months and then you cycle off for 2 weeks and then you go back, you can do another cycle for 2 months. So you really can, depending on like where you're at with your health goals, can figure out, okay, what do I want to do now? What do I want to come off? Um, and yeah, so.
Yeah. And there's even some, peptides that the company has that's for sexual health
Oh
that,
yes.
declines with age that people don't really like to talk about, even with their doctors.
Yeah, I forget.
Yeah.
I forget. Yeah, that we have
Yeah.
the thrill pill.
The thrill pill, right.
I know one of my friends, she was like the thrill pill, and I was like, it does exactly what you think. We
Yep.
have the Elate spray, which is similar to it's the same thing as the thrill pill, but it's a nasal spray, so it actually works a little faster.
Yeah.
And then the PT-141 is injection. So all those help with libido, help with just that sexual function and arousal, that kind of thing. So yeah.
Yeah. So that's a nice perk too, if you
Yes.
want to stay incognito with it.
Right, right.
Oh, and that's another thing too, is when customers order, we don't see what they're ordering.
Right.
That like HIPAA part of it, the privacy is there. We just see that we got an order, but we don't know what's ordered unless the
Yeah.
customer actually tells us. I like that privacy part that the company has.
Yeah, same, same. And most of the time we know what they order because we've had a
Right.
discussion and we're talking to them about it. But yeah, sometimes, I mean, I had somebody order the other, and then sometimes you can kind of tell based on like the price that came through, you're like, or the volume, you're like, okay, she must have ordered this because it's.
Yeah.
But yeah, but yes, with HIPAA, they don't let us know like what's been purchased. It's just you get an order saying, or you just get an email saying you have a new customer. So,
Yeah.
um,
All right. Well, I
yeah,
don't see any more questions right now.
okay, cool. Well, like I said, get back with Missy or I if you have questions. We can share our link if you're interested. Oh, I just froze. Can you see me? Oh, there we go.
Yep, there
Okay.
you are.
Okay, I froze for a minute. And then, I always touch on like the business part a little bit because it's
Yeah.
one of those, you just, I mean, who doesn't need more money? So it's one of those, we get paid to share what we love. And the way LA works is it's an affiliate plus model, meaning you have an affiliate link, so you give your link out, and if somebody orders, you make 20 to 40% commission. And then if you want to build a team, like Missy's on my team, then you can, and then you make a certain percentage, on your team, but you don't have to do that. Like some people just, do the affiliate portion. And you can totally do that. I mean, you can definitely make a few $100s. You can make enough to get your peptides paid for. And that's what some people do.
Yeah.
They're like, I just want to get my peptides paid for.
Yeah.
So, you have two or three friends, sister mom, and I mean, this is where the healthcare is going. It's really going towards peptides. So, if you're interested in the business opportunity, we're happy to chat more with you about that. We have an amazing team. Like we actually have the fastest growing team in the company.
Yeah.
We have weekly trainings. We actually have one tonight, in an hour. So we have our team huddles on Tuesday nights. We have a whole onboarding system. I was talking to somebody today. She was like, "Do I have to create a website?" I'm like, "No, no, no.
No.
Like everything is set up for you. Like you have a website, they've just started this whole LEMD hub, which has so many resources in it. So if you're a business, you can, if you're wanting to get this into your salon or your med spa or your doctor's office, like it's all set up for you. It's really, truly like plug and play.
Yeah.
Like no overhead, no inventory. Like you really, like all the resources are there for you. Our team gives shareable things that we can share in our stories and
Yeah.
content ideas. And so it's really just about sharing what we have our hands on and, making some money while we do it. And our job as brand partners is to educate and support and, help you through your journey. And that's what really makes LA different than these other companies that you can just go on and order a cheap peptide. Like nobody's following up with you. Nobody's checking
Right.
in to see how you're feeling. Nobody's checking in to see, how your progress is. So we're really, monitoring all of that. And then every Thursday, Ellie does an educational series. We have a YouTube channel, so you can go to the YouTube channel and see like all the past educational series where we always have some kind of a medical healthcare professional talking about education on peptides and how they're helping.
Yeah. Yeah.
Jason Pensick, Dr. Jason Pensick. If you don't follow him on Instagram, look him up.
Yes.
I've learned so much from him. I just sent his
Same.
profile to somebody the other day. He's amazing, and he's done several talks for us because he's so well versed, and he's very well known in the peptide world. He's given talks at peptide conferences, and he's a chiropractor and a nurse practitioner. So definitely check him out on Instagram. And yeah, let us know if you have any questions.
Thank you guys for listening
All right.
in.
Thanks, everybody.
Have a
All
good
right.
night.
Have a good night.